The March of Dimes released its prematurity report card last week. It highlights maternal and infant health outcomes. And here to talk about that is Emily Cattell with the March of Dimes. Thank you so much for being here.
Thank you for having me.
This is such an important report that we talk about every year. So this year, what did it find?
It found that we continue to see a maternal and infant health crisis, especially when we're looking at prematurity. For the United States and for Wisconsin, we saw that our prematurity rates increased, and it also increased here in Dane County.
Okay, so these are troubling findings, troubling numbers. What are some of the reasons that we're seeing an increase in prematurity?
Well, 1 in 10 babies are born premature in the state of Wisconsin, and we also see that 1 in 10 women receive inadequate prenatal care. So it's not the number one cause or the exact cause, but I think that correlation is pretty telling. We also see a higher chance of prematurity in women who smoke, in women who have hypertension before they get pregnant, and then other health concerns that would impact their pregnancy.
Sure, so many reasons that we're seeing this outcome. My first was born a little premature, but he had a heart issue, so a lot of different reasons that we're looking at and investigating here. There are also some racial disparities in birthing outcomes. What are we seeing?
So for black infants in the state of Wisconsin and black mothers giving birth, the chance of prematurity is 1.7 times higher. So we definitely know there's lots of different reasons. We know that black mothers do have a higher chance of having that hypertension. We know that people of color tend to see those social determinants of health being higher. So living in areas of poverty, having less access to health care, having less access to healthy foods and housing. So all of those things can impact your pregnancy and whether or not you can have a healthy outcome.
And so a lot of things to work on. When it comes to the infant mortality rate, what did the report find?
We continue to see for the United States that our infant mortality rate is climbing, but it did decrease a little bit for Wisconsin this year, so we're kind of headed in the right direction for that. But the number one cause for infant death before the age of 1 in the state of Wisconsin is complications from prematurity. So as we see that prematurity rate increase, we're definitely going to see more infant deaths before the age of 1.
So what did we find that Wisconsin is doing well, and then what are the areas that we need to improve upon?
Again, compared to the United States, we are doing a little bit better. We do have pockets that are a little bit better, but the one thing that we need to do is continue to fight for moms and babies in the state, whether that is passing legislation like Medicaid postpartum to 12 months to allow for moms to get that care before they go on to their next pregnancy, and then also just, again, finding ways to get women to the hospital so they have that adequate prenatal care.
So for the women out there who are considering becoming pregnant or who are pregnant, some of these results can be a little scary. So what would you like them to know?
Go to your primary care doctor as often as you're able and as often that is recommended, so you can get those healthcare concerns checked and in control before you get pregnant. If you are underweight or overweight, or if you have hypertension or diabetes or any other healthcare concern, make sure that you have that under control, or make sure that your primary care doctor and your OBGYN are aware of that so they can monitor those health concerns while you're pregnant.
And of course, the March of Dimes does a lot for expecting moms and moms who've had struggles. So thank you for all the work that you're doing as well. And thank you for being here to share.
Thank you. And if anyone's interested in learning more about March of Dimes and our report card, you can go to marchofdimes.org.
All right, Emily, thank you.
Thank you.